Good afternoon. My name is Dr. Gary McCallum. I'm the wound care physician here at the Arkansas Heart Hospital. I'd like to give you a little bit of background about myself. I'm originally from Arkadelphia. I graduated UAMS in 2001, which is where I also completed my emergency medicine residency. I've been with the facility now for about 15 years. And last but not least, I'm the father of 4 children, which means my poor wife is raising 5 kids. So today we are going to be talking about the innovative benefits of hyperbaric oxygen therapy. So what is hyperbaric oxygen therapy? In a nutshell, we take patients, we place them in a chamber that can withstand high pressures, then we pump 100% oxygen within those chambers, and what that does is that drives the oxygen into the plasma and allows it to diffuse better into the tissues. We know this occurs because of Henry's law, which states that the diffusion of a gas is directly proportional to the partial pressure of that gas above the liquid. And when treating the patients that we have, we can actually increase their oxygen delivery by about 10 to 20-fold. So some of the standard treatment indicators that we use it for in the emergent situation is decompression sickness, carbon monoxide poisoning, air and gas embolisms, but in wound care we also use it for diabetic foot ulcers, osteomyelitis, and radiation-induced soft tissue injury. There's a new and exciting research, however, to show that there's emerging reasons to use it for a lot of different neurologic disorders such as autism, acute and chronic strokes, dementia, and PTSD. So the reason that I bring this slide to your attention is because it points out a fact. We have known for years that hyperbaric oxygen therapy is beneficial. So if you'll notice, this is the New England Journal of Medicine, but notice the date, 1969. And what this study showed is that hyperoxygenation can actually increase the cognitive function in demented patients. So despite this research, this groundbreaking finding, it has been ignored for well over 50 years. So what are the benefits of hyperbaric oxygen therapy? Well, we know that it increases mitochondrial activity, leading to an increase in production in ATP. We know that it decreases oxidative stress and neuroinflammation, and that it can actually regenerate white matter in the CNS. This is another one of the big benefits of hyperbaric oxygen therapy, and it's in the form of angiogenesis. We know that hyperbaric oxygen therapy can increase the formation of blood vessels in tissue, and it mainly does this through like certain growth factors such as vascular endothelial growth factor, VEGF. And we can see this actually in animal trials. So this is, it's a busy slide and I apologize, but it proves a point. So this was an article that was done in 2014. And what they did was they looked at a sham group, a control group, and an HBO group. And they took slides of these post-stroke rat models at certain intervals, at 4 days, 7 days, 14 days, 21 days, and 28 days of treatment. And if you notice, this is the control group, but look at the hyperbaric oxygen group. You can actually see microscopically that it does form new blood vessels. We can see that on this model as well. In this case, they used CD31 endothelial cell marker, and what they did was they looked at a sham group and they looked at an HBO group. The pink arrows are pointing towards the blood vessels, and the reason I bring this to your attention is because it not only shows that you can increase the number of blood vessels, but you can also increase their diameter. And as you can see here, there's large, beautiful, plump vessels in many of them. So what do you do in humans? Well, you can't take tissue samples of the brain, but with the new advancements in neuroimaging, we can now see that it actually causes increased perfusion in humans treated under hyperbaric oxygen therapy as well. So this was an article in 2015. And what they did was they used perfusion MRI. Now, the way perfusion MRI works, it uses a color coding scale. And so the darker the color, the less perfusion. So the violets and the blues, as you notice, those are poorly perfused areas. As you go to green and then yellow and then finally red, which is normal tissue, it increases it shows you the areas that are better perfused. And so this one on the left looked at cerebral blood flow. And this is before treatment, and this one here is after treatment. Notice how that blue now turns to red. Same here. Lots of blue. This is cerebral blood volume. After treatment, much more improvement. This is another example. Actually, let me make a point too. Notice that these are in post-traumatic brain injury patients. And look at this is 10 years after the acute event. This is another example of a perfusion MRI in a stroke and pre and post HBO treatment. So in this case here, you're looking at the classic anatomical MRI. Look at this one. This here is the pre and this one's the post. But look at the areas of poor perfusion before treatment and the much more perfused areas after treatment. And the researchers found this actually correlated with what they were finding in percent changes in improvement of 36% in working memory up to almost 50% in reading comprehension. So this is a groundbreaking study, and the reason for that is because this is one of the first of its kind. It was a prospective randomized trial that was performed by Dr. Afradi in 2013. He is at the Segal Institute in Tel Aviv, and they do a lot of research on hyperbaric oxygen therapy. And so what he did was he looked at the effects of hyperbaric oxygen on neuroplasticity in the brain. And so he took a group of patients, 74 subjects, I believe, and proved that neuroplasticity occurs by using something called SPECT. And what SPECT is that is single photon emission computed tomography. And what it does is you inject the patient with a radioactive isotope. Then special cameras are able to detect gamma rays from that patient and form a 3D image which shows the areas of better and worse perfusion. So this is an example from that study of a 64-year-old woman who had left hemiparesis due to ischemic stroke, but look how far out, 26 months prior to inclusion in the study. So if you notice the parietal and the temporal lobes, there's not much red. This is the baseline, and this kind of correlates to what they're seeing on the anatomical CT. After treatment, lots more perfused normal tissue, which actually correlated with an improvement in her motor function in this patient. This is another example from that same study. It's a 62-year-old woman, and she had right hemiparesis and aphasia that occurred 14 months prior to her inclusion. And if you notice the areas in the green, these are areas that actually are kind of stunned. These are areas that possibly could show benefit from hyperbaric oxygen therapy. So you have the motor cortex, you have the Broca's area, and this is basically a three-dimensional view. So you have the medial, the lateral, and the superior view. And if you look at it before treatment and then look at it after treatment, you show great improvement. And they could see this clinically. This patient in particular almost was able to speak fluently after treatment. The reason that I bring this study to your attention is because it's another groundbreaking study. It was a meta-analysis, and it actually assessed the evidence from 25 randomly controlled trials with a total of 2,000 dementia patients. And what they found from this, the take-home from this study, was that there was a strikingly high difference between the HBO-T group and the control group in the mini mental state exam scores, showing that this is the ability of hyperbaric oxygen therapy with neural rehab potential. One of the ways that you can actually investigate that is something through what's called NeuroTrax deltas. NeuroTrax is like a computer algorithm software that takes different points and tries to take those values and compare them to a control. So in this study in particular, the reason I bring it up is that after the study, not only did you have general cognitive score that were increased, but you also had significant increases in immediate nonverbal memory, delayed nonverbal memory, attention, and information processing speed sky high. This is 8-point difference. That's the highest that you can get with the NeuroTrax deltas. In conclusion, hyperbaric oxygen therapy has been shown to be beneficial through increase in cerebral perfusion and by inducing neuroplasticity in a multitude of different neurocognitive disorders, and should be investigated further in the future. That is my time. Thank you.